Namaste and hello everyone. Welcome to this special session on the fascinating topic link between food and skin allergies. So I'm Divya and I'm thrilled to be hosting this session. So before we dive into the topic, let me introduce our in-house expert, Dr. Lata Rijhwani. She is a renowned dermatologist with a wealth of experience and knowledge in her field. So welcome, Dr. Lata. It's a pleasure to have you here. We are excited to learn from your expertise.
Thank you, Divya, and good morning to all our listeners and viewers. And it is always nice to be on this platform. And I hope this video will prove helpful to many of you.
Yeah. So let's begin our discussion. So for today's session, my first question is, ma'am, like what is an allergy and what we specifically mean by a food allergy?
Uh, to put it very simply, Divya, an allergy is basically an immune reaction to a substance which our body will recognize as foreign. So, any substance that our body takes as a foreign agent, our body will try to react, and this response or the reaction, it manifests in the form of allergy. And the substances what we are talking about, these are known as allergens. And food allergy, if you are asking specifically, so food allergy is basically immune reaction to some proteins which are present in our diet or our food, which our body takes as harmful substances, or as I told, strangers. And so our body will try to, generate a response, and it will manifest in the form of food allergy. So other than food, Divya, the substances or the allergens, they can be present in various, things like in our surroundings. There can be house dust mites, there can be certain insects, there can be some medications, and there can be variety of food items. So our body will, react against those, and that is what we call as an allergy.
Okay. So thank you for the explanation, ma'am. So before moving further, viewers, do you want to consult with top dermatologists like Dr. Lata to get expert advice and personalized treatment plans for your from the comfort of your home with eGlobalDoctors? So let's move to the next question. So, ma'am, how can we identify a food allergy and like what are the common symptoms of it?
See, to diagnose food allergy, it is always at every step, it is very important to have a very careful history, especially from the mother. And it is only mother or the caretaker or whosoever the child, generally the allergies they present at very young age. So there is a typical history that after consumption of certain foods, generally food allergies are very acute in presentation, like within few minutes to hours the child will develop a variety of symptoms which we'll talk later. And so and every time that particular food is consumed, those symptoms they will present, and they will become worse every time the food is taken. So a very detailed history of what the child has consumed is very important to diagnose, and it is generally immediate. Within few hours, within minutes to 2 hours, everything is going to manifest, and by the time the child has to be taken to the hospital if the symptoms are severe.
Okay. So that's very helpful, ma'am. So, now I would like to know about the age factor. So, at like what age do food allergy reactions commonly occur, and how can we differentiate between food allergy reactions from the other types of skin allergies?
As I told you earlier, the food allergies are usually they present at a very young childhood. Sometimes they may even present in infancy, because generally after 6 months, when the foods are introduced, the mother may notice that certain foods are not, accepted by the child. So let me first talk about how do you know that it's a food allergy. So if a particular food is consumed within minutes or say few hours, the child can have variety of symptoms. There can be mild symptoms in which there can be slight tingling of throat, there can be swelling of lips, swelling of tongue, swelling of face. There can be redness all over the body. There can be red bumps, which we call as urticaria. It's a very common presentation that we dermatologists are dealing with. That big red bumps will be there all over the body. Then if we go to the severe symptoms, the child or whosoever is having food allergy can have dizziness, can have blurred vision, the blood pressure may drop, and finally it may lead to anaphylactic shock if the allergen is, if the food allergy is very severe. And what happens is, as I will now answer the second part of your question. See, the pre-existing skin disease is generally, it is not related to food generally. Although those who have food allergies, their pre-existing symptoms, they also worsen if they are consuming certain foods. But generally, it is present every time. It is not related to consumption of a particular food. And food allergies, they're generally typically manifest around mouth, like swelling of lips, whatever area comes in contact. Sometimes you can see severe swelling of lips. And so food allergies are typically, they manifest after consumption of a particular food, unlike the pre-existing diseases that are not related to the food. They're always there.
That's very helpful, ma'am. So thank you for helping us to understand how a food allergy might manifest on the skin. So moving further, so ma'am, what are the most common foods that tend to cause allergic reactions?
Yeah, this is a very important question. See, generally, milk and chicken and eggs and peanuts. In fact, milk, peanuts, and eggs, they constitute about 85% of the culprits. They are known to cause 85% of the food allergies. Apart from that, there are many other foods which are implicated, in which the top list is next to these three that I told, that is chicken, consumption of seafood, fish, and there can be all varieties of milk are, they can cause soy milk, cow's milk. And apart from foods, certain medications, especially the painkillers, they are very important triggers of, these kind of allergies.
Okay, so
Yes,
that's a
add,
valuable.
sorry to interrupt you, all the additives and preservatives in the foods, which we don't know, unknowingly or knowingly, every day we are consuming, they are very potential triggers to cause food allergies. So those children who have food allergies, we always advise them to check their labels carefully, and it is best to avoid the outside food and the packaged food as much as possible, because the colorants, the preservatives, they are all potential triggers of, and even the pesticides nowadays, our food is food full of chemicals and pesticides. So even a small trace of pesticide, if it goes with your food, suppose you are not washing your apple properly, or your cucumbers you are consuming with the peel, they can lead to very food allergic reactions.
Okay, so that's a valuable information, ma'am. So now, speaking of foods that trigger allergies, so we talked about common foods. So let's discuss how can we identify the specific food that triggers an allergic reaction.
Yes. As I mentioned earlier, a detailed history rather than jumping to the tests straight away, which are not, very, very helpful. Detailed history of what the child, since childhood, when the foods were introduced, what form of milks were introduced, and what is the daily routine of the child. If the child is very young, for example, less than 2 years, generally they don't eat too many items a day, and the mother knows very well what they are taking. So it is very important to maintain. We generally tell our patients to maintain a diary, and date wise what they are using, what they are consuming, we have to know that. And the mother will typically point out that when this particular food, like for example, if the child is allergic to egg, even if the cakes are consumed or certain bakery is consumed, she can point out that yes, then I noticed that this form of allergy was manifesting. So a very detailed history, you have to give time to your patient. So most of the times it is the mother or the caregiver, they diagnose. But because if the child is older, they are going outside, they're going to the birthday parties, they're going here and there, it is not so easy to point out. But as I told, and then we can just tell them a list of the known culprits, that if the child is frequently on such kind of, like nuts. I forgot to mention pistachios and walnuts and cashew nuts again are important triggers. So we can give them list of the items that what all mother should take care that what all out of these is consumed. So a detailed history, and of course, then there are tests also we can do to identify. For example, if from history we come to know that okay, the child whenever he consumes pistachios or eggs, the allergy manifests. So depending on the history, we can then undergo some tests to confirm the food allergy.
So thank you for explaining that. So as you mentioned about the test, so next let's talk about the testing. So ma'am, how is food allergy testing is conducted?
Yeah. See, as this the history taking is again first and foremost part of at every step, as I told you earlier. And then nowadays there is one oral food challenge test that has become the gold standard. Like before, we used to do a lot of prick tests and skin tests and blood tests, and oral food challenge test was placed in the last. But nowadays it is very practical to do oral food challenge test. I'll come to it that what is it exactly means, rather than straight away jumping to prick tests which are very invasive. So if you talk about allergy testing, we have two types of tests. Oral food challenge, I will talk about later. There are blood tests and there are skin tests. So in blood tests, what we do is that whenever allergen enters our body and our body produces a response, there is an antibody known as IgE antibody that is produced by our immune system. So if a child is allergic to a particular food, or in general, many foods, for example, the IgE levels in our blood will be found markedly raised. So IgE testing is very simple, non-invasive. It can be done even in very young children. It does not require any prick. It is not related to the medicines he or she is taking. So measuring IgE is one of the important blood tests. Then we can even do allergen-specific IgE. For example, I want to do IgE to egg, for example. I can even order such kind of tests. So in blood test, the major thing is to measure the IgE. Then we come to the skin tests. In skin tests, what we do is, for example, we suspect 5 or 6 food allergens. We just place those allergens on the forearm of the patient, and minute pricks are given. And if a child is reacting to a particular food, that area small red bumps will be produced. And so this is also an important part. But although skin prick test we should reserve for very special cases, before doing this we have to do oral food challenge test, which is simpler, it is practical, and it is non-invasive also.
That's good to know. So ma'am, now once a reaction is confirmed, what should be done initially to manage the food allergy?
Yes. See, if there are from the history and from the blood tests and from the prick test, if the facility is available and your doctor has confirmed, then oral food challenge test is also done. For example, everything, because allergy testing and to diagnose a food allergy is not, it's not very simple. It's not like 2 plus 2 is not 4 in this. It is a very complex thing, and it requires multiple sittings with your dermatologist or allergist, whosoever is treating, detailed history and all. For example, we have confirmed few foods that are causing allergy. There is a process, we call it elimination diet. Your doctor, with the help of dietitian, the role of dietitian is also important. We want that the child should avoid certain foods, but on the same time that the growth of the child should not be affected. Like for example, if the egg is avoided, we can give calcium and all in other forms. So it is the whole team has to work together. In elimination diets, what we do is that we eliminate the suspected allergens from the diet for a particular period of time. When the child is symptom free, then one by one we go on adding the foods, just to confirm again, and also to reintroduce the food in small quantities and see how then the child is responding. So elimination diet is one. Then again we have to, as I told you, we have to inform. For example, if your child is going to a party, the host has to be informed that my child is allergic to this. You have to check labels if we are going to restaurants, and the restaurants also, you have to be very careful about certain foods if it is confirmed. So that thing will be always there. Elimination will be there. You have to be cautious. And then if allergy happens, then what? So if the symptoms are mild, mother can give antihistamines. For example, there is only slight redness, few urticarial wheals are there. It's okay. It can be managed by over-the-counter medicines. But if the child is having difficulty in breathing, congestion, and there is wheezing, breathlessness, and you see the child's condition is deteriorating, one, directly can go to emergency. Second, always, if once the food allergy is confirmed, there is one EpiPen, this adrenaline has to be kept by mother or by caretaker. They have to know how to inject it just to prevent the anaphylactic shock and to save the child. So once the allergy is confirmed, you have to, they will, the doctors, they will have sessions with you. They will train you how to, if the child is older, even the child can also inject sometimes. So there is a full protocol that has to be followed for this.
Thanks for those steps, ma'am. So, like you mentioned about the oral food challenge test, ma'am, like
Yeah.
could you explain more about the oral food challenge test and how it is performed?
Yeah, see, oral food challenge test is very practical and feasible method for the suspected food allergens. In challenge test, what we do is that in presence of your doctor, under supervision of your doctor, you are given low doses of the suspected allergens. So whatever foods we are suspecting that you will be allergic to, your doctor will be giving you. Generally, these foods, they come in the form of capsules. Suppose you are given one capsule and the doctor is observing you, there is a backup of emergency management. If 10 to 15 minutes no reaction occurs, then the doctor will increase the dose of that food. So slowly the dose of the suspected allergen is increased. For example, you consumed the full dose of food and you have no reaction. That means you are not allergic to that particular food. People, they, because of so many false positive tests, they stop eating so many food items without even confirming. But actually they are not allergic to it. For example, the child is not consuming milk since 2 years of age, and through oral food challenge test we come to know that he is not allergic to milk. So there is a long list of foods that the mothers, out of their fear, out of only by looking to the reports, they are stopping. But through oral food challenge test, one by one food item can be tested. At a time, we can test only one item. So if you are allergic, the doctor is always there to take care of your allergic reaction. And if you are not allergic, it's fine. You can now consume the food. And also, Divya, one important point is that children, they generally outgrow. The one good thing is, fortunately, children outgrow food allergies. About 70 to 80% of children by the age of, say, 14 to 16 years of age, they can outgrow the allergies. So it is not that they have to stop things for life. So through oral food challenge test, your doctor can very well, and without pricking or without even doing any blood test, can very well diagnose the food items that are causing allergy. Or maybe you are not allergic to them and you are simply restricting them.
Yeah. So, very informative, ma'am. So, like now, for those with a confirmed food allergy diagnosis, like what steps should be taken for its prevention and management?
Yes, this will be, Divya, the summary of what I have mentioned throughout this session. That once the food allergy is confirmed by your doctor through proper tests and oral food challenge and everything, they will put you on elimination diet. That is the best thing, that you have to avoid it. You know that you will be allergic, so you avoid it. So at home, it is easy, it is simple. But as I told you, the child should be educated. If the child is big enough, educated to take care of what he's eating, check the labels, always best to avoid outside food as much as possible, because there are lots variety of things going on, the sauces and everything. So because it is not lifelong, the mother and children, they have to be counseled that they will eventually outgrow it. It is just a temporary thing. But until then, it is best to avoid the foods if possible, and you can look for many alternatives. It's not that if one food you cannot consume, there is a lots more that you can consume. So with the help of your dietitian, you can discuss that. Second, as I told, the symptoms, one has to be very clear. Okay, if I have tingling in throat or if I have difficulty, immediately I have to take steps to stop it then only through antihistamine pills. And if the symptoms are severe, like if the child or the child's parents, here the genetics is also very important. If the parents have a history of severe food allergy, the child is likely to end up in having severe food allergies. So they have to be cautious that, okay, if it happens, first thing, avoid it. If it happens, what steps, one, two, three, I have to take. And the EpiPen or the auto injectable epinephrine has to be there every time the child or the mother has to take along with her or him, because there sometimes the allergies are so severe, Divya, that you don't even get time to reach the emergency. So each patient is counseled and trained to inject that. So this is the last resort. I'm talking about the severe allergies, and before that, the steps that I have mentioned have to be taken.
Yeah. So thank you for sharing all these valuable insights, ma'am. This information will certainly help our viewers better understand food allergies and skin allergies and manage them effectively. So before we wrap up, I want to remind our viewers that eGlobal Doctors provides you with access to top oncologists for second opinion. Early detection and expert care are essential in the fight against cancer. So book your consultation now. So thank you, Dr. Lata, for sharing your expertise with us today. Your insights have been invaluable. So viewers, if you have any further questions or concerns about your skin health, don't hesitate to reach out to the experts at eGlobal Doctors like Lata Rijhwani. So thank you, Dr. Lata.
Thank you for having me, Divya. I hope that the topic is very vast, and I hope we could cover some insights about this. And the viewers can always get back if they have any particular query about their case.
Yeah. So viewers, we hope this session has provided you with valuable information. Remember, taking care of your skin is an essential step towards achieving healthy and radiant skin. And you can reach out to our Dr. Lata Rijhwani anytime at eGlobalDoctors.com. So thank you for watching. It's a wrap.